Okay, we're gonna do some tales from the table today. I keep wanting to do these because I am just so passionate about manual therapy and how it can help people and how I see it transform lives and how little people understand the importance of touch and what it can do, the impact that it can have on people's lives. And so I'm just gonna start telling some stories. The first story I want to tell is about a 6-year-old kid. When he had first started to learn to walk, he broke his leg. And now at 6, he's toothless and adorable. It grew back fine. Everything's fine. It was just a little fracture. But the tibia and the fibula have tension between them, and it makes his calcaneus kind of funny. And what's happened is that pattern is now also gone up to his low back, to where he doesn't have low back pain at 6, but he's setting himself up for a little disc issue with how his pelvis is rotating and how that L5 is kind of sliding down because of how funny that calcaneus is from this old injury that we don't think about. We don't think about treating kids proactively after they get injured. And I think it's a great disservice for the longevity. How many times do I see patients that are dealing with things now that they had when they were babies? One of my other clients today, hip pain. He is like a biohacking machine. He is all over the biohacking world, all about it, doing all the things with the right people. Super smart. He's built kind of like a military guy, like strong and a little stiff. And he had an abdominal surgery when he was a baby. And that is causing so much tension in his pelvic floor and his entire abdomen. And it's showing up, the scars on the right side. And it's a thick scar pulling his whole greater omentum into it, creating this lockdown. So all the little crural nerves that are coming out through the rectus abdominis and the obliques have this line of tension to where the viscoelasticity of soft tissue muscles like the bladder doesn't have its space to expand and contract properly. So what I said is, if you don't have bladder problems now, it's coming, just because the bladder doesn't have that muscular ability to expand and contract properly because of that tension. What's also happened in that case is his right hip pain, which he's had stem cells in, but nobody's actually touched it in a way